All right, everybody. Hope everybody had a good lunch. This is the second half of the day. I think, Ken, if we could put my slides up, that'd be great. Awesome. And we kind of, called a year of evolution for the department. And first, I want to thank the Abbott Society for allowing us to put a great meeting together, and also the program chair. I know Debbie Dang keep us, on task, have a great program set for us, and also Drew Lansdowne is actually away from us. So really, thank you, God, for doing this for us. I also want to thank again for our friends, our visiting professor, Dr. Lisa Lotz from Mount Sinai, and also Kevin Bozick, from Dell, Medical School to spend time with us. So, well, thank you for being, us. I know it's a long 2 days over there. It's not over yet till tonight, but thank you. Really appreciate your time. Okay. And I've been reminded, and also I went outside also to thank all the sponsors and exhibitors. Without their support, we won't be able to go host this meeting. Thank you for them again helping us, yeah. I think you're right, Kevin. I can't see these words from here. I need to really, frown over there. So, okay. So I'm supposed to kind of talk a little bit about the state of the department. So a little bit overview about what we've done over the past year. As a department, right now we have over 117 faculty, over 400 staff, 40 residents. Thank you. 12 fellows, and then actually, we have an enterprise of over 125 million as an enterprise for the Department of Orthopedic Surgery. Out of the 104 clinical faculty, 35% of faculty right now are non-surgical faculty, which is very different from the composition of the department years ago, which also kind of reflect how we manage musculoskeletal injuries as a community right now. We're not just a surgical department. There are a lot of non-surgical care being delivered in musculoskeletal space, and that's why we want to kind of continue to build that area of our department. But there are challenges. When I took helm about 2 years ago, there are challenges with academic medical centers. There's increasing focus on clinical care, expansion of clinical footprint, so the department spread, in a much wider space. There's also scrutiny in terms of our identity as scientific community. There are challenges and uncertainty of NIH as a big research academic institution. That's something actually really challenging what we're going to do moving forward. And there's also about the value of education. How do you balance teaching versus delivering on care? So we need to change, and I think that we need to evolve. So after I became chair 2 years ago, one of the things I challenged the group is that how do we actually get better as a department? We actually sought some outside help. We employed J3P, which is a strategy firm that helped us kind of do some strategy building, work on department reorganization. This was an 18-month endeavor that all the faculty and staff was involved. We actually got questionnaire from everybody, give us advice, and we also had different groups to help us lead some of the changes. I want to share with you some of the results that we have over there. This is the current structure of the department, which is very different from what it used to be. We actually have 7 vice chairs that allow them to kind of meet with me more regularly, and each vice chair have their domain to focus on what their activities are. So it's kind of what Dr. Bozick mentioned earlier. I need to be delegate for people to help me do my job, and these are the people that I really trust to help me do that the activities that actually allow the department to function well. I'm going to go through each role, briefly. Our current executive vice chair is Dr. Brian Feely, who is also the chief of sports medicine shoulder service. His role would be serve as a central liaison between the division chiefs and also the vice chairs, and bridging the gap sometimes between our clinical and academic missions. So he works very closely with our division chiefs, and there are 11 of them. The role of the division chief has also changed a bit compared with years ago. Now the division chief really look across the enterprise about how their care is how their specialty care is actually being delivered. So they're not just responsible for particular sites, they really look at their specialty in terms of how care is being delivered across the different campuses. And also how do we support the faculty that work at different campuses in terms of academic growth. So they really kind of have a lens across the entire department. Our Vice Chair of Education is Hubert Kim. Most of you know about Hubert's kind of impact as an educator. He'll continue to have a kind of really high-level view about how the department's working in terms of education programs. I also want to kind of share with you all, which I think we did last year, is that we do have a new program director, Dr. Tony Ding. So after 21 years of leadership in the residency program for Dr. Kim, he passed on this role to Tony this past year. So thank you for kind of leading the efforts on this. We have 40 residents. They're actually from very different parts of the world and different parts of the country over here. You guys still kind of amazed at looking at your names up there, right? So you still have little gestures up there. So I think we're very proud of you guys. And very soon you'll be actually sitting on the other side of the room teaching us over here. But besides the Department of Orthopedic Surgery residency, we now actually have other GME programs within the department. So as I mentioned earlier before, we have Department of Orthopedic Surgery, which is a legacy program. We also have the UCSF Staying in Podiatry program, which is led by Dr. Larry Orloff, who actually joined our faculty the past year. We also have a proposal to have PM&R residency start at UCSF. So as a top 5 medical school in the country, as one of the top leading educators in the country at UCSF, we have one GME program we don't offer, which is PM&R. So UCSF do not have a PM&R residency, while we currently have 21 faculty in the School of Medicine under our department that actually PM&R trained. So this is clearly a deficit for the school, a deficit for us as a community. So we are actually really want to push forward to start a residency program, and hopefully we'll bring some great news to you all next year. Besides GME education, we also want to focus on our medical student, which is led by Nikki Schroeder, and also some of the efforts we have in terms of CME. So some of you actually help us in terms of lead some of our CME activities across the department. These are the activities we have right now, where it's actually ranging from regular CME courses locally, or actually different parts of the U.S. or outside of the U.S. But we want to have a more coordinated effort working on this, because we all have different course directors. We actually face some challenges and kind of difficulties. How do we do this better as a group? We have to do it, kind of led by Dr. Beanie. He's going to help us make this process better. Our Vice Chair of Faculty Affairs, Dr. Bobby Tay. Bobby is actually well known to the department. This is a different role for him, for us. Really help us in terms of advancement and promotion of our faculty, and also how do we support them to be more successful. As we have grown as a department, we're just spread out to different kind of geographic sites. There may be less opportunity for teaching. There may be less opportunity for research. How do we get people engaged? That's Bobby's role. As I shared, we're 170 faculty, over 14 different clinical disciplines. We actually reorganized in terms of how the faculty is being supported by different division chiefs. And also pleased to share with you all that we have some new faculty has joined us. We have Dr. Sethi, who is our new chief of spine, Dr. Amika Cohn, which is actually in the physical medicine rehabilitation division, working primarily over at Laguna Honda and Zuckerberg San Francisco General Hospital. Dr. Kaya has joined us officially as an adjunct professor, one of our scientists that actually work in translation research. Dr. Robert Kinningham, and also Osterhaus is actually in primary care sports medicine. Dr. Larry Orloff, as I mentioned earlier, as our program director for the podiatry program. And Anthony Wiggins, actually our arthroplasty, our latest kind of faculty that graduated from a program, went to New York, we brought him back home, and now actually working with us in Marin, actually in the city. So welcome you all. In terms of the support of the faculty, what we invested on through J3P is some of the leadership development. Kind of mentioned in Dr. Bozik's talk too, is that we want to be kind of, get teaching leaders for the next, generation. So we actually invested in one-on-one coaching for about 19 faculty. Most of them actually leaders we've chosen to be in the role. We also have 4 other applicants for this upcoming year. We also have 27 faculty actually part of the leadership development program. These are more programmatic, kind of education instead of one-on-one. Idea is actually develop more clinical educators and research leaders within the faculty and help us to be better. Well, Dr. Sabatini is our Vice Chair of Health Equity. As you all know, this is a passion of Coughlin, has done a lot of great work recognized by the Academy and also other entities already in terms of impact, in terms of how we actually could expand and maybe operationalize our global surgery programs, and also guide the department's commitment to engagement programs and coordinate patient-focused system-level equity efforts. These are some of the summary of many efforts that the department's working on. So despite some of the challenges, we're still really kind of focused on how we actually make sure orthopedics are exposed to multiple different areas of the community. How do we actually develop pipeline programs, support people to like what we're doing, or support what we're doing, and make some impact over there. I also want to share with you, during COVID, we had to stop some of these programs. So we've restarted some of the global, visiting scholar program to UCSF. So the past year, we have 217 visitors from 20 different countries that actually came to UCSF. These are people that we could learn from. This is actually something they can learn from us. And actually in the audience, we may have three actually visiting from within US, three trauma surgeon visiting us over today. So this is the exchange we want to have. We can't just learn from ourselves, we have to learn from others. That's what we want to be. I would be kind of very, excited to share with you all that both in IGOT and Actua, which are two of our global, programs, have received significant funding over the past year. IGOT got $1 million from the WIS Foundation to support their efforts, working in Africa. And also Madeline McKechnie and Ted McLeod's work on Actua actually got a $700,000 award from WIS also. So congratulations, so thank you. Dr. Candymer is our new Vice Chair of Quality and Safety. Most of you know Dr. Candymer as the person who's going to operate on Saturday morning, maybe Friday night over here. The reason why he's a good candidate, because he does have a lens of, kind of work in Zuckerberg General Hospital, also Mount Zion, and other places. So he actually have a better view about, how care has been delivered. So we put charge on him in terms of, being our Vice Chair of Quality and Safety. He's in charge of coordinating all this quality control and also improve clinical care pathway across different systems, and to work on quality metrics that are specific to MSK care within the health system. And more importantly, sometimes we do a great job, but how do we tell people about it is that you need to interact with external benchmark in terms of how to actually look at, how we've been rated as a department. I'm actually very proud to share that we as a department is recognized very highly across the country. We're actually top 10 in terms of the National Orthopaedics Hospital ranking. Both the Children's Hospital and the Adult Hospital actually ranked as top hospital by Leapfrog ranking. And the UCSF Spine Center has recently been recognized by the Joint Commission as a Center of Excellence. This is the combined center between the orthopedics and neurosurgery group. This is a great recognition for them, yeah. Research is core to what we're doing. Chris Hernandez is our new Vice Chair of Research. His charge is really coordinating research efforts within the department, not just on basic science, not just on translation, but really across the whole continuum, from basic science work, translation work to kind of clinical care. These are some of our kind of performance as a department. So we've done quite well in terms of NIH funding, but we need to be smarter, because NIH has been, is undergoing a lot of scrutiny right now. It will change in terms of how we actually support research moving forward. So there are different commitments we need to have as a department. I do want to share some of the success we have over the past year. Dr. Michael Davies, which I think that is at the back over there, standing up over here. He received a $500,000 grant from the AOSSM and also Arthritis Foundation for his work on glenohumeral joint arthritis. Dr. Chris Stewart won one of the resident award at the WOA, which is the Western Orthopaedic Association. Dr. Kelsey Collins, which is one of our scientists, actually won the NICS Award from the Academy and ORS. The NICS Award was also known as the previous Kappa Delta Award. Again, the Nobel laureate, prize for the research committee in orthopedics. So she kind of won that award. And her postdoc, Hope Wellhaven, won the New Investigative Research Award at the ORS. So congratulations, yeah. One of the challenges we have for the research group is that we have done really great independent research, in the past. I really challenge the group to do more collaborative research beyond, individual programs, really in terms of coordination of efforts and direction of investigation. We have a few centers at UCSF. We have some success in the past. We want to do better. We have the MSK Center, which is really looking at musculoskeletal research across, the entire school here. We have the P30, which focuses on basic science investigation. We actually do have, a lot of lofty goals to kind of look at a P30 for a clinical, research in the future. With HIVE, led by Chris Hernandez, which actually help innovation via engineering, really linking the engineering community here at UCSF and Berkeley, and hopefully have more kind of success in translation research. And we're also the C Doctor, which is led by Jeff Lotz. We're actually really good about bringing kind of science into clinical use. Ted McLeod is actually our vice chair of system operation. This is a role I have to kind of pull Ted out, kind of help me out, because Ted's been doing so successful work over in Zuckerberg. As we've grown as a department, there are different systems we had to work on. We have different clinical locations right now, 17 of them. There are 4 health systems we're working on right now as a department. So I need his knowledge and wisdom to help us coordinate some of the efforts. So for the alumni group, I want you to look at this, kind of map and see where you were, doing your learning when you were a resident with us. I think for the people that actually graduated maybe 30 years ago, maybe in maybe 3 dots on that, on that map on the San Francisco County side. Maybe for the 30-year group, they may be 1 dot over the East Bay side, and the 20-year group maybe a little bit more. This is in how big the department is right now across 17 locations around the Bay Area. So it's extremely important for us as a department to stay together as a department, think about the same way, even though that we may be at different campuses. So Ted's role is really important. How do we coordinate our clinical growth? How to improve care coordination within the system itself? And I also want to share with you all that our department has been prominently focused on the UCSF Health 5-year clinical enterprise plan. They will actually start that plan in July, and our department is prominently featured in terms of what their focus is going to be. So there will be resources given to us to grow, but we need to grow kind of in an appropriate manner so we can maintain our mission. I do have one, aspiration goal in the future is when patient want to call for an appointment or go online and sign up, there'd be 1 phone call they call, and we'll be actually on the back end, actually able to figure out where they could be seen, how they could be seen, and where the best expert is. Not saying that, hey, I'm going to call a certain number at UCSF and say, well, we can't see you because it's insurance. Why did you call so-and-so number? And they will see what they can figure out, and another one could turn around. So we need to do a better job to help patients navigate with the system, because we are the system right now. I do want to spend some time talking about our community and our people. And one of the things that I do want to kind of create as a department is that not just the clinical care, the research, or the education we do, is that how do we build a community? I think the people makes a difference in terms of how the department works. These are some of the events we actually do as a department. I will be kind of I'll be very, very, I'm very, honored to kind of say that, it's for the people that missed yesterday, May 7th, 2026 was the Dr. Richard Coughlin, MD Day, kind of appointed by Dan Lurie, our mayor. So congratulations, Rick, over there in terms of what you're able to achieve. So, yeah. And I share with people all the time to say, we all do great work, but sometimes we don't tell people what the great work we're doing. But when we tell people about it and when people acknowledge it, it's time to celebrate. I say, Rick, this is time to celebrate over there. Don't need to be shy about it. Don't need to be humble over there. When we get the recognition, we should kind of make an effort to celebrate that. So hopefully I'm kind of embarrassing him right now, but this is what we should do as a community. These are the clinical staff that help us be successful. I want to show some of the pictures of research staff and academic staff. This is time for me to kind of really make them appreciate all their work. Without their work and dedication, we won't be successful as a department. So thank you. Yeah. We're fortunate to get some recognition over the past year. So we have the UCSF Physician Award. I did take your picture out, Kevin. Kevin actually was the first faculty at UCSF that actually got the Physician of the Year Award. I think it was 2007, okay? And we do have 2 new winners this year for the past year. Dr. Chloe Dodd, which I just learned that she's going to arthroplasty during this meeting. Heartbroken. And Dr. Yumi Mitsuo, which is our pediatric physiatrist. So congratulations for them, yeah. One of the things I think we as a department need to think about is how do we support our academic mission. So we are fortunate as a department over the years, we have these endowed professorships. These are very prestigious kind of recognition, usually by grateful patient or grateful donors to support our mission. So over the past history of the department, we have 15 endowed professorships that support the activities. Depends on what type of, whether it's education or research or clinical care. I'm actually also proud to kind of announce to you all that we actually have 2 endowed professorships that we actually established this year. The first one is a Melissa Mao Endowed Professorship for Orthopedic Surgery. This is actually being put forward by Alicia. Where are you? Alicia presented to the OIF Symposium a few years ago, finding that there is a big gender disparity in terms of endowed professorship in orthopedic surgery across the country. It was 2%? What was it? 2%? 2% of endowed professorship across the country are given to women. Even in our department, actually, it was like 0. So it was kind of really disappointing for a department that we champion, diversity and recognizing, kind of differences. So we actually have, our first endowed professorship that is actually set for supporting a early career female faculty in the area of musculoskeletal injuries. And our first, inaugural recipient is actually Patricia Zhang, who is the head of our PM&R group. So congratulations on this. And I shared with the department before too, it's not likely that we're going to have another year like this. We have 2 endowed professorships in the same year. We sometimes have to wait for years before we have this. This year we also have the Lowenberg Family Endowed Professorship in Orthopedic Trauma. David Lowenberg, obviously as you know, is alumni of us. Now is actually back as faculty with us. And Dave as a family is able to donate for this cause for recognizing excellence in orthopedic trauma. And our first recipient for this inaugural holder is Sam Oshed. Yeah. So people say, well, we have grateful donors, we're grateful faculty. What is the department doing for us? As a department, we're also committed to what we actually do at the education and research. We actually established the first musculoskeletal medical student education endowed professorship. This is an administrative professorship really actually for the support efforts of the director for MSK medical student education. So Dr. Nikki Schroeder is our first recipient of this established endowed professorship. Congratulations, Nikki. This is over years of effort, Nikki, over there. I'm sorry that we actually didn't have this established earlier, but hopefully this kind of recognized your efforts over the years. So thank you. Yeah. I would be kind of be remiss if actually we mention all the graduating chiefs. So this is about you two for this meeting. So congratulations for the class of 2026. One of the things I always want to share with you all is that when you finish, you are part of the alumni. You will be part of the Abbott Society. I want you to be just like the other alumni. Come back to us, teach us, interact with us, be part of us, because that's what we want the community to go. So congratulations, yeah. And you get about about an hour and a half before your capstone project presentation. So don't get too nervous in the next hour and a half or so. Okay, so yeah. I also want to congratulate the other graduates. We have other programs we have within the department. Our Podiatry in residency class, orthotics and prosthetics class are graduating also. Congratulate these graduates over here. We do have 8 new interns coming on board. I think Nick Hill actually was here yesterday. He's actually here today also. He's starting early. He's our intern, actually started 2 months earlier, so welcome. I also want to kind of congratulate the fellowship that graduating this year. Yeah. I do want to take a moment to kind of pause and let the department remember Richard Capra. Richard Capra was our CAO. It's up to 2023. He still stayed with the department until like summer of this past year. Richard actually started off, his healthcare career as a radiology tech and joined UCSF actually in 1980. He actually had 25 years of service on the department. So Richard actually have led the department through ups and downs, and the success of the department right now, a lot of it's actually up to him. So besides his administrative work, he's also a dear friend and a colleague. So I want people to kind of think about him during this time. So. I also want to kind of share with you all some of the retirements coming up over here. I know that Jeff is not here in the audience, but hopefully he'll join tonight. Jeff is our first scientist in the department that was hired in 1992. And he actually transformed the department to become an academic department. We are now one of the strong research program in the country. A lot of innovative research is done. I'll show some of the work that his group is doing right now. We went from one scientist that he joined, 1992, to 13 scientists right now in the department. So Jeff will still be around, so we gotta bring him to kind of still help us, kind of with grants and guidance. So congratulations to Jeff, yeah. And also want to kind of point out Dr. Ellie Delgado. Ellie is actually in the audience over here. Ellie joined the department in 1989. Ellie was a former nurse that specialized in training and treating children's bone disorder. That's inspired her to go into pediatric orthopedic surgery. This is 4.5 decades of work that she has spent with us at San Francisco. Ellie, thank you so much for all your contribution to us. Yeah. Now, I spent the past, 20 minutes talking about the program. Obviously, we have a different structure where actually the structure allows you to look at the department across different campuses, how we actually be more organized, integrating programs. We're also new leaders. We're new leaders right now looking at different domains. We actually provided with some training and also, increase our impact to the community, broaden our clinical impact and academic excellence. For the people, we invest in the staff support, coordination and engagement. And the goal is to evolve to be a more integrated, impact-driven organization. But work is coming. I tell the people all the time that change happened the past year with different structure, different leaders being trained right now to lead their work. Now the work starts. So I would challenge you all to look at your domain and see how we could be better as a leader within the department. And for the faculty, what could you do better in the future? So hopefully with the structure allows us to be more successful. And what do we want to be? We want to be excellent. That's what we want to be. So as a department, we're one department. We're multiple campuses. There are different specialties that we have. But we actually want to have one mission. We want to have one community, and community include all the alumni over here. I want you to be part of this department. And what we want to do is a pioneer, musculoskeletal care to transform lives. So I, Benjamin Ma, is actually honored and privileged to be the chair of the department for you all, serving you all, and I look forward to the future. The future is exciting and bright, but we need all your support. So thank you for your attention. Yeah.